Would I benefit more from under-eye surgery or under-eye fillers? Hi, I'm 24 and have had bags since I could remember. Both sides of my family suffer from dark circles and bags under the eyes. However, this issue has made me very insecure, and I'm ready to make a change about it. I was wondering if you guys could give some advice as to which procedure would help smoothen out that area under my eyes. Thank you.
Thank you for your question. You submitted your question with a close-up view of your eyes, and you're asking, is it better for you to have surgery or to have fillers? And you state that you have had under-eye bags since as far as you can remember, and that both sides of your family have these characteristic under-eye bags and dark circles. So you're trying to figure out what's the best way to approach your situation. You're 24 years old. Well, I can certainly share with you the concepts that I apply to my practice when I meet patients like yourself every day in my office. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, helping people with their under-eye bags with surgical and non-surgical solutions has been the core of my practice for years, and it is certainly evolved over time with newer technologies and newer strategies, which is of course why this is a point in time where you can ask a question like between surgery and fillers. So let's understand some basic concepts. First, what is it that you're dealing with? You're dealing with a condition called lower eyelid fat prolapse. Lower eyelid fat prolapse means that the fat that's normally around your eyes pushes forward, creates these bulges under the eyes, and that's referred to as herniated fat. In the modern world, over the past many years, the concept of helping camouflage the lower eyelid fat has certainly been a very useful tool in our practice to help patients who have a minimal amount or up to a moderate amount of fat. But it depends a lot on the anatomy, the bone structure. And this is very, very important. So if somebody has a certain amount of limited fat prolapse pushing forward, and they have a certain amount of projection to the bone under the eyes, then you can fill that space called the tear trough with a filler, such as a hyaluronic acid filler in the Restylane or Juvederm family. And that can help buy a lot of time. When I look at your photo, and in the absence of a physical examination and looking at the relative projection of your cheek, my leaning is more towards doing it, would be approaching your situation surgically, because the fat prolapse essentially is going to a level where there's not much space to actually place a filler. Further, in order to try to blend that area, I can tell you from patients who've come to my office after having this done, a lot of times patients will get filler, then they'll get more filler placed on the front of their cheeks to try to blend with this bulge of fat, and that ends up being very much counterproductive. Very often that is done by non-surgeons or by doctors who cannot perform lower eyelid surgery. Now, of course, at 24 you might be hesitant about doing a surgical procedure, and certainly we have dealt with this a lot over my decades of practice. In fact, we recently just helped a young woman who was 19 years old and had a similar type of situation. Basically, the approach in our practice is to do a procedure such as in your situation, called a transconjunctival blepharoplasty. Transconjunctival blepharoplasty means that the fat pockets are approached from the inside of the eyelids. Years ago, I had advocated this procedure particularly for darker skin types. And that was after noticing a lot of people who have darker skin, and that means anybody with an olive complexion or darker, were getting surgery where incisions were made under the lower eyelid, and they were not having good outcomes with the scars, and their lower eyelids were becoming retracted, and that was particularly true in people who have very prominent eyes. So by doing this procedure from the inside of the eyelid, I'm able to preserve the anatomy of the muscles that are critical for maintaining eye shape and aesthetics as well as function. And in so many ways, it's as minimally invasive as you can get with surgery and still get a real outcome to address the underlying issue. Now further, in our practice, we do our procedures with local anesthesia and light sedation. And we do it within our office in our Joint Commission approved facility. So for many patients, and patients come to us from all over the world for this procedure, they like that they don't have to go to a hospital surgery center, and they can comfortably have the procedure done and be discharged without having to go under general anesthesia. Further, it is routine for us to also use something called platelet-rich plasma to help with those dark circles under the eyes, to help with some of the skin quality. At 24, it may not be as critical, but it might have some potential benefit, at least at the time of surgery. I find it to be very versatile and very useful. It's derived from your own blood, and it contains the wound healing and growth factors that help address skin quality and dark circles. Now, as far as the future is concerned, even after you get the puffiness reduced, you may want to consider other things such as fillers depending on your bone structure. So when you ask a question like whether or not to do surgery or fillers, I often take the photos of my patients, and I take them from all angles, and I try to explain to them that once you get past the puffiness under the eyes, well, if you need a little bit of volume in your cheeks or anywhere else on your face to help create harmony, that might be something worth considering. Generally speaking, on younger people like yourself, like a 24-year-old, that's not really an issue, but I wanted to at least mention that in case there is some other potential opportunity that you may want to address. So I think it's very important for you to get a proper evaluation by a qualified, experienced cosmetic surgeon who performs lower eyelid surgery a lot and is comfortable with dealing with all skin types and is very good at, in particular, the transconjunctival approach from the inside of the eyelid. And I think you'll find that doing this will make a real big impact. I have to say, in years and years of practice, that helping someone with under-eye bags is one of the most satisfying things that we do. In patients' entire face, it's like getting a facelift. The full face opens up and brightens up. So I think this is worth pursuing. Just find a doctor you're comfortable with. So I hope that was helpful. I wish you the best of luck. Thank you for your question.